Assalamu alaikum, dear listeners. Salma Shahid is here from Department of Biochemistry. In our last lectures till now, we have studied about anatomy and physiology of respiratory system, and in some other lectures we have discussed about the breathing mechanism, that is how the gas exchange occurs and other mechanisms that take part in the respiratory system. Today, our lecture is all about respiratory disorders. It means that when respiratory system does not function properly and something goes wrong, then what happens in this case? So let's start our today's lecture of respiratory disorders. Here is the diagram which represents the respiratory organs. Some important respiratory organs are presented here. As we can see, epiglottis. The respiration starts from oral cavity that contains mouth, then comes pharynx, larynx, trachea, and then lungs. Lungs contain bronchi and alveoli. While in case of expiration, air moves in the opposite direction. That is, starting from lung, air moves towards the oral cavity. The respiratory disorders are linked to the respiratory organs. Here is the list of orders or malfunctioning depending upon the respiratory organs, such as there are some diseases related to upper airways, diseases related to bronchi, malfunctioning of the alveoli and the alveolar ducts. Similarly, disorders of pleura, disorders of mediastinum and diaphragm, some viral infections of the respiratory system, similarly bacterial infections of the respiratory system, and other allergic lung diseases. If we talk about its detail and examples, diseases of upper airways include cancer of the larynx and sleep apnea, while diseases of bronchi include cystic fibrosis, bronchiectasis, and bronchitis. Similarly, malfunctioning of alveolar ducts and alveoli includes emphysema and pneumonia. We will talk about in detail about these diseases in upcoming slides. Similarly, diseases of pleura include pleurisy and pleural effusion, and viral infections. The common viral infections present in our population, they are common cold, laryngitis, influenza, tracheitis, bronchitis, and viral pneumonia. Similarly, the bacterial infections include pneumonia and tuberculosis, and allergic lung diseases include asthma, acute bronchitis, bronchiolitis, bronchiectasis, chronic obstructive pulmonary disease, and pulmonary emphysema and lung cancer. There are some activities of respiratory systems other than respiration that also change the activity of the respiratory system. For example, sighing. It's a long, deep inspiration followed by a short, large expiration. We call this expression sighing. These activities include in the emotions. Then comes yawning, the entrance of the air to the open mouth instead through the nose. Hiccoughing, here comes hiccoughing. It is caused by the contractions of the diaphragm. It is the sudden movement of the diaphragm. Normally it occurs uh, in case of thirst or in case of shortage of water in the digestive system. Then comes sneezing. Sneezing, it is similar to coughing, except that the expelled air is sent through the nose. Then comes coughing. It's a full inspiration followed by rapid expiration, often, and it is often virulent. Then comes laughing. Actually, laughing and crying, both of these expressions and movements, they are physiologically much alike, and often pass into one another under emotional stress. So the major respiratory problems on which we will talk about today in our current lecture, they are asthma. What is asthma? Asthma is the airway when airways become narrow and make too much mucus. The situation is known as asthma. Another very important respiratory problem is emphysema. The others are pneumonia, influenza, tuberculosis, commonly present in our population, chronic bronchitis, and cystic fibrosis. Cystic fibrosis, this disease is caused by a problem in genes and gets worse over time if not cured timely. It causes lung infections don't go away. There is another very important disease not mentioned here, lung cancer. When cells in the lung change and grow into a tumor, that is known as lung cancer. This often happens because of smoking or caused by a problem in the genes and also gets worse over time. It causes lung infections that don't go away. And tuberculosis, actually tuberculosis, it's a bacterium that causes this dangerous infection. It usually affects the lungs but might also involve kidney, spine and brain. And in case of pneumonia, in case of influenza as tuberculosis, it's a viral infection and is caused by various viruses and oftenly known as seasonal flu. While in case of pneumonia, it's an infection that causes inflammation in the alveoli. They might fill up with fluid or pus. So let's talk about in detail. First of all, what is asthma? Asthma is a disease that affects lungs. It is one of the most common long-term diseases of children, but adults can have also asthma. Asthma causes wheezing, breathlessness, chest tightness, as here, and coughing at night or early in the morning. If anyone or a patient have asthma all the time, he or she can experience all these changes, but he will be attacked by asthma attacks only when something bothers the lungs. We don't know all the things that can cause asthma, but we do know now that some genetic factors, environmental factors and occupational factors have also been linked to developing asthma. If someone in the immediate family has asthma, in the immediate family you have asthma, the people are more likely to have it. That is known as atopy. That is the genetic tendency to develop an allergic disease. It can play a big part in developing allergic asthma. However, not all asthma is allergic. Being exposed to things in the environment like mold or dampness, some allergies such as dust mites and second-hand tobacco smoke have been linked to developing asthma. Similarly, air pollution and viral lung infection may also lead to asthma. There is a type of asthma known as occupational asthma, which occurs when someone who never had asthma develops it because he or she is exposed to something at work. This can happen if we develop an allergy to something at work, such as mold, or if we are exposed to some irritants such as wood dust or chemicals. So, main causes of asthma are airborne allergies such as pollen, dust, mites, mold, spores, pet or particles of some waste material. Similarly, some respiratory infections such as common cold can cause asthma. Physical activities, cold air and air pollutants and irritants such as smoke, they can cause asthma. They have multiple causes. For example, there are some causes related to allergy and there are some causes related, there are which are non-allergic causes. What is asthma attack? When we breathe normally, muscles around the airways are relaxed, letting air move easily and quietly. But during an asthma attack, three things can happen: bronchospasm, inflammation, and mucus production. Now, what is bronchospasm? The muscles around the airways constrict, that is become tighten, and when they tighten it makes the airways narrower. Air cannot flow freely through constricted airways. And what is inflammation? The lining of the airways becomes swollen. Swollen airways don't let as much air in or out of the lungs. Then comes mucus production. During the attack, the body creates more mucus. During asthma attack, the body creates more mucus. This thick mucus clogs airways. So we can say that patient is under asthma attack. When airways get tighter, a sound that is called wheezing will come out from the respiratory system. And when the patient breathes, a noise from the airways make when the patient breathe out. You might also hear an asthma attack that is called an exacerbation or flare up. These are terms which are used when asthma is not controlled and becomes severe or acute asthma. The condition is known as acute asthma. The acute asthma attack is characterized by acute difficulty in breathing, in which mucus clogs the airways, air passages, in such a way that air cannot be inspired out properly and also not inspired in. Despite the severe respiratory difficulty, the patient remains fully conscious. The most dangerous form of the condition is known as status asthmatic attack. A different or common asthma attack triggers. You can have an asthma attack if you come in contact with substance that irritate you. Healthcare providers call these substances as triggers of asthma attack. Knowing what triggers the asthma makes it easier to avoid asthma attack. For some people, a trigger can bring on an attack right away. For other people or at other times, an attack may start hours or days later on. Triggers can be different for each person, but some common triggers that include air pollution, that is many things outside can cause an asthma attack. Air pollution include factory emissions and car exhaust, wildfire smoke, and many more. Then comes dust mites. You can't see these bugs, but they are in our homes. If you have a dust mite allergy, this can cause an asthma attack. Then comes exercise. In case of exercise, for some people, exercising can also cause an attack. So in this case, when the patient of asthma must avoid a severe exercise. Then comes mold. Damp places can spawn mold, which can cause problems if you have asthma. You don't even have to be allergic or mold to have an attack. In case of pests, cockroaches, mice, and other household pests can cause asthma attack. And in case of pets, your pets can also cause asthma attack. If you are allergic to dried skin flags, breathing in the danger can irritate your airways. While tobacco smoke, we talk about tobacco smoke. If you or someone in your home smokes, you have a higher risk of developing asthma. You should never smoke in closed spaces, that is, like a room, like the car or home. And the best solution is to quit smoking. In this case, some smoke providers can help. Strong chemicals or smells. These things can trigger attack in some people. While certain occupational exposure, you can be exposed to many things at your job, including cleaning products, dust from floor or wood, or other chemicals. These can all be triggers if you have asthma. What types of asthma are there? It's very important to know the types of asthma. Okay, asthma can also be intermittent and persistent. What is intermittent? Actually, asthma is broken down into types based on the cause and the severity of the symptoms. Healthcare providers identify asthma most of the times as intermittent and persistent. Intermittent, this type of asthma comes and goes, so you can feel normal in between asthma flares and asthma attacks. While in case of persistent asthma means you have symptoms much of the times, and symptoms can be mild, moderate, or severe. depending upon the situation or the attack. Healthcare providers and doctors base asthma severity on how often you have symptoms. They also consider how well you can do things during an attack. There is also a type known as adult onset. This type of asthma starts after the age of 18, that is, in the adult age, when someone has neither shown any symptoms of asthma attack before in the childhood or before 18. The type will be known as adult onset. And pediatric, it's also called childhood asthma. This type of asthma often begins before the age of 5 and can occur in infants and children, toddlers. Children may outgrow asthma. You should make sure that you discuss it with your doctor or health provider before you decide whether your child needs to have an inhaler available in case they have an asthma attack. So your child's healthcare provider or doctor can help understand the risk. In addition, there is another type, exercise induced asthma. We have also discussed in last slide. This type is triggered by exercise and is also called as exercise induced bronchospasm. Then comes occupational asthma. This type of asthma happens primarily to people who work around irritating substances. Then comes asthma, COPD, overlap syndrome, ACOS. This type happens when you have both asthma and chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease include emphysema and asthma both. Both diseases make it difficult to breathe. So what happens in case of asthma attack? During normal breathing, inhaled air, we have already studied about it, that inhaled air travels through two main channels, primary bronchi that branch within each lung into smaller, narrower passages known as bronchioles, and smooth muscles that surround the airways pass. This result in tightening, and finally the air goes into the tiny terminal bronchial tubes. While during an asthma attack, some smooth muscles that surround the airways pass. This result in tightening of the airways, swelling and inflammation of the inner airway space due to fluid buildup and infiltration by immune cells and excessive secretion of mucus into the airways. So consequently, air is obstructed from circulating freely in the lungs and cannot be expired out. So we can say that asthma is characterized by spasmodic contraction, that is the hindered contractions that become blocked and stopped contractions of the smooth muscles of the airways, or you can say more easily blocked contractions of the airways by increased production of an abnormally viscous mucus by bronchial mucus glands, and in severe attacks by airway obstruction from mucus that has accumulated in the bronchial tree. This results in a greater or lesser degree of difficulty in breathing. In this diagram, we can see here clearly a picture showing normal airway and the picture showing obstructed airway. In case of obstructed airway, the mucus and the spasm has blocked the airways, and inspiration, respiration becomes difficult. Then comes emphysema. Chronic obstruction, also known as chronic obstructive pulmonary disease. Actually, it refers broadly to a group of conditions that cause irreversible respiratory impairment by increasing obstruction to airflow through the bronchi of the lungs. This condition occurs most commonly in current or regular cigarette smokers and affects some 2 to 10 million people worldwide. The World Health Organization estimates that 5% of all deaths around the world, they are due to this COPD, chronic obstructive pulmonary disease. So COPD typically has two components which may be present to varying degree: chronic obstructive bronchitis and pulmonary emphysema. Here in the current slide, we are studying about pulmonary emphysema. Individuals who predominantly have emphysema exercise experience symptoms that differ in detail from those who predominantly have chronic bronchitis. However, both disorders contributes to shortness of breath during exercise and to general disability. So, emphysema, it's a condition that involves damage to the walls of the air sacs. Here is the diagram showing the normal alveoli and the alveoli affected by emphysema. It's a condition that involves damage to the walls, we can see here, of the air sacs or alveoli. Alveoli, they are small, thin-walled, very fragile air sacs located in clusters at the end of the bronchial tubes and deep inside the lungs they are present. There are about 300 million alveoli, as we have already studied in last lecture. In normal lung, when we breathe in the air, the alveoli stretch and draw oxygen in and transport it to the blood. When we exhale, the alveoli shrink, forcing carbon dioxide out of the body. So when emphysema develops, the alveoli and lung tissues, they are destroyed. With this damage, the alveoli cannot support the bronchial tubes. The tubes, ultimately the tubes, bronchial tubes, they collapse and cause an obstruction or a blockage. They cause blockage which traps air inside the lungs. Too much air trapped in the lungs can give some patient a barrel-chested appearance. Also, because there are fewer alveoli, less oxygen will be able to move into the bloodstream. So, shortly, emphysema is a lung condition that causes shortness of breath. In people with emphysema, we can say that the air sacs in the lungs or in the alveoli, they are damaged and blocked. The important question is here, who gets emphysema? So, we can say that the important question is here, who gets emphysema? We can say that over 3 million people in the world, only in the United States, have been diagnosed with emphysema. Over 11 million Americans have COPD, and emphysema is most common in men between the age of 50 and 70. And the main reason is the smoking. So if we talk about symptoms and causes, what are its causes? Smoking is the number one factor. Because of this, emphysema is one of the most preventable types of respiratory diseases. Air pollutants in the home and workplace, genetic factors, and similarly respiratory infections can also play a role in causing emphysema. Cigarette smoking not only destroys lung tissue, it also irritates the airways. This causes inflammation and damage to cilia that line the bronchial tubes. This results in swollen airways, mucus production, and difficulty in clearing the airways. All of these changes can lead to shortness of breath. So, what are main symptoms of emphysema? Symptoms of emphysema, they may include coughing, wheezing, shortening of breath, chest tightness, and an increased production of mucus. Oftentimes, symptoms may not be noticed until 50% or more of the lung tissue has been destroyed. Until then, the only symptoms may be a gradual development of shortness of breath and tiredness, fatigue, which can be mistaken for other illness. People who develop emphysema have an increased risk of pneumonia, bronchitis, and other lung infections. So the patient should see the doctor if any of these symptoms arise. That is, if there is shortness of breath, especially during light exercise or climbing steps, and if there is ongoing feeling of not being able to get enough air. Similarly, long-term cough, in case of long-term cough or smoker's cough, in case of wheezing, long-term wheezing sound coming from lungs, long-term mucus production, and in case of ongoing fatigue. What is the diagnosis and the test for this problem? How the emphysema is diagnosed? The diagnosis of emphysema cannot be made solely on symptoms. Several tests are also used to make the diagnosis. One simple test is to tap on your chest and listen with a stethoscope for a hollow sound. This means that air is being trapped in the lungs. So other tests include X-ray. X-ray, they are generally not useful for detecting early stage of emphysema. However, X-ray can help diagnose moderate or severe cases. Either a plain chest X-ray or CAT, that is the computer-aided tomography. This can be used. Only once the test is completed, the readings are compared to X-ray of the healthy or normal lungs, and it is diagnosed if emphysema is on which stage. Then comes pulse oximetry. This test is also known as oxygen saturation test. It is used to measure the oxygen content of the blood. So this is done by attaching monitor to a person's finger, forehead, or earlobe. Then comes spirometry and pulmonary function test (PFT). This is one of the most useful tests to determine airway blockage. The spirometry or PFT tests the lungs volume by measuring airflow while a patient inhale and exhale. Then comes arterial blood gas. This test measures the amount of oxygen and carbon dioxide in the blood from an artery. So it's a test often used as emphysema becomes worse. It is especially helpful in determining if a patient needs extra oxygen. And the ECG, electrocardiogram. ECG check heart function, and are used to rule out heart disease as a cause of shortness of breath. In case of management and treatment, how emphysema is treated, um, the most important is to quit smoking. If someone smoke, he or she should quit it. This is the most important step that a patient can take to protect the lungs. It's never too late to quit smoking. The doctor can help the patient to find the best smoking quitting method. Then bronchodilator medications. These medications or medicines relax the muscle around the airways. They are often used to treat asthma. Similarly, bronchodilators given through handheld inhalers also produce more immediate result and have fewer side effects than oral medication. Anti-inflammatory medications. These medications reduce inflammation in the airways. However, long-term side effects of these drugs include osteoporosis, hypertension, high blood sugar, and fat redistribution. So there is also another oxygen therapy not mentioned here. The oxygen therapy is prescribed for patients whose lungs are not getting enough oxygen to the blood. That is in case of hypoxemia. These patients cannot absorb enough oxygen from the outside air and need to get more oxygen through a machine. And normally a catheter or a face mask, a nasal face mask is used in this case. In case of lung volume reduction surgery, the it involves removing a portion of the diseased lung tissue, then joining together the remaining tissue. Doing this may relieve pressure on the breathing muscles and help improve lung elasticity. The result of the surgery have been very promising. Not all patients with emphysema are candidates for this surgery, but surgery is only done in case of severe cases. What is pneumonia? Another very important disease and present in our population is pneumonia. It's an infection in one or both lungs caused by bacteria. If it occurs in only one lung, known as simple pneumonia, and if it occurs in both lungs, it is known as double pneumonia, and is caused by bacteria, viruses, or fungi. The infection leads to inflammation in the air sacs of the lungs. Here is the diagrammatic representation of how pneumonia occurs. Which infection leads to the inflammation of the air sacs of the lungs, which is known as alveoli. The alveoli fill with fluid or pus, making it difficult to breathe. Here we can see See the normal alveoli where spaces where there are air spaces, and the alveoli they are empty to take air in. But in case of pneumonia, alveoli with pneumonia, we can see that fluid and pus filled air space contains bacteria and some blood cells, and there is no more space for air to come in case of inspiration. The alveoli fill with fluid, making it difficult to breathe. Both viral and bacterial pneumonia, they are contagious. This means they can spread from person to person through inhalation of airborne droplets from sneezing or cough. You can also get these types of pneumonia by coming into contact with surfaces or objects that are contaminated with pneumonia and are causing bacteria or virus. You can contact fungi pneumonia from the environment. Take fungi pneumonia. It does not spread from person to person, but it is present in environment. So if we talk about its types and classification, we can say that it is further classified according to where or how it was acquired. The hospital acquired pneumonia. This type of bacterial pneumonia is acquired during a hospital stay. It can be more serious than other types as the bacteria involved may be more resistant to antibiotics. Then comes community acquired pneumonia. This refers to pneumonia that's acquired outside of the medical or institutional setting. Ventilator associated pneumonia, when people who are using a ventilator get pneumonia, it's called VAP. Aspiration pneumonia, inhaling bacteria into the lungs from food, drink, or saliva can cause aspiration pneumonia. It's more likely to occur if we have a swallowing problem. So, if you are too sedated from the use of medications, alcohol, or other drugs, it's the possibility that you can acquire aspiration pneumonia. There is also another type, the common term used as walking pneumonia. Walking pneumonia is a milder case of pneumonia. People with walking pneumonia may not even know that they have pneumonia. Their symptoms may feel more like a mild respiratory infection than pneumonia. However, walking pneumonia may require a long recovery period. The symptoms of the walking pneumonia, they can include mild fever, dry cough lasting longer than a week, chills, shortness of breath, chest pain, and reduced appetite. Viruses and bacteria like Streptococcus pneumonia or Haemophilus influenza, they often cause pneumonia. However, in walking pneumonia, there is another bacteria that is known as Mycoplasma pneumonia. They most commonly cause this condition. What are pneumonia stages? There are two stages of pneumonia: bronchopneumonia and lobar pneumonia. Bronchopneumonia, they affect areas throughout both of the lungs. It's often localized close or around the bronchi. These are the tubes that lead from your windpipe to the lungs. While in case of lobar pneumonia affects one or more lobes of the lungs. Each lung is made of lobes, which are defined sections of the lung. Lobar pneumonia can be further divided into four stages based upon how it's progressed. That is known as congestion. This condition occurs when lung tissue appears heavy and congested and fluid filled with infectious organisms. They have accumulated in the air spaces. The second condition is red hepatization. In this case, red blood cells and immune cells have entered into the fluid. This condition makes the lungs appear red and solid in appearance. The third condition is, in case of lobar pneumonia, is gray hepatization. The red blood cells have begun to break down while immune cells remain. The breakdown of red blood cells cause a change in color from red to gray. And fourth one is resolution. Immune cells have begun to clear the infection. What are common symptoms? Common symptoms include coughing that may produce mucus, fever, sweating or chills, shortness of breath, chest pain, feeling of tiredness or fatigue, loss of appetite, nausea or vomiting, headache. Other symptoms of pneumonia, they vary according to the age and general health. Infants may appear to have no symptoms, but sometimes they have vomiting, lack energy, or have trouble drinking or eating. Children under 5 years old may have fast breathing or wheezing. Older adults may have milder symptoms. They can also experience confusion or are lower than normal body temperature. If we talk about causes of pneumonia, pneumonia happens when germs get into the lungs and cause an infection and produce mucus and block the airways of the alveoli and the tubes. The immune system's reaction to clear the infection results in inflammation of the lungs airspace or the alveoli. This inflammation can eventually cause the air sacs to fill up with pus and liquids, causing pneumonia symptoms. Several types of infectious agents that cause pneumonia, they include bacteria, cause bacterial pneumonia, virus, cause viral pneumonia, and fungi, cause fungal pneumonia. In case of bacterial pneumonia, there are three bacteria most important: Mycoplasma pneumonia, Haemophilus that cause Haemophilus influenza, and Legionella pneumonia caused by the bacteria Legionella. While the most important is Streptococcus that cause Streptococcus pneumonia. If we talk about viral pneumonia, the respiratory viruses, they are often the cause of pneumonia. Examples of viral infections that cause this disease, they include influenza, commonly known as flu, respiratory syncytial virus, RSV, rhinoviruses that cause common cold, human para-influenza virus, HPIV, human metapneumovirus infection, measles, chickenpox caused by Varicella zoster, adenovirus infection, coronavirus infection. You can write down these viruses, their names, and they are actually the common viruses that cause flu, and we will study in detail about these viruses in our course known as virology, and probably you will study in your 8th semester. There are also adenoviruses that cause adenovirus infection, coronavirus, the recently spread epidemic we passed through, and the SARS-CoV-2 infection, the virus that caused COVID-19. We will study in detail about all these viruses in the course of virology. Although the symptoms of viral and bacterial pneumonia, they are very similar, viral pneumonia is usually milder. It can improve in 1 to 3 weeks without any treatment, as we have no antiviral drugs available right now against the viruses. But if the patient occur the bacterial pneumonia, it might be more worse as compared to viral pneumonia and might be treated with the help of antibiotics, as antibiotics are available against almost all bacteria. Then comes fungal pneumonia, the third type. Fungi from soil or bird droppings can cause pneumonia. They most often cause pneumonia in people with weakened immune system. So the examples that of the fungi that can cause pneumonia, they include pneumocystic gyrovacea. You can write down these fungus names: pneumocystic cystis gyrovacea, Cryptococcus species, and Histoplasmosis species. What are risk factors? Anyone can get pneumonia, but certain groups do have a higher risk. These groups include infants from birth to 2 years old, people ages 65 and older. They are most probably, they can be easily attacked by the pneumonia causes. People with weakened immune system due to pregnancy, HIV, the use of certain medications such as steroids and certain anti-cancer drugs. People with certain chronic medical conditions such as asthma and or containing cystic fibrosis or having diabetes, COPD or heart failure, sickle cell disease, liver disease, kidney disease. The patient having any of these disease is more likely to cause pneumonia attack. as compared to the healthy person. People who have been recently or are currently hospitalized, particularly if they were if they were on the ventilator, so they are more likely to acquire this disease. People who have had a brain disorder which can affect the ability to swallow or cough, such as stroke, or someone having a head injury, or someone having dementia or Parkinson's disease, they are more likely to have pneumonia. Similarly, people who have regularly exposed to lung irritants such as air pollution and toxic fumes, they are especially on the job. Similarly, people who lived in a crowded living environment such as prison or nursing homes, and the people who smoke regularly, which make it more difficult for the body to get rid of mucus. So all of these are risk factors for a person to have pneumonia. What is double pneumonia? Double pneumonia is a lung infection that affects both of the lungs. The infection inflames the air sacs in the lungs or the alveoli, which fill with fluid or pus. So this inflammation makes it hard to breathe. The most common causes of pneumonia, they are bacteria and viruses. Infection from fungi or parasite can also cause pneumonia, double pneumonia. Similarly, double pneumonia can also be characterized by the number of segments of the lobes in the lungs that are infected. That is, if more segments of the lungs are infected, whether in one lung or in both lungs, the disease is will be known as more serious and more acute. You can catch pneumonia by coming into contact with infectious viruses or breathing in infectious air droplets. And if double pneumonia is not treated, any pneumonia can be life threatening.